Welcome, everyone. For those on the Pacific Coast, good afternoon. On the East Coast, I guess still good afternoon. And those in Europe, good evening to you guys. Hopefully, you joined the right webinar. Today, we are going to talk about the competitive UX benchmarking. We're going to walk through some high-level insights across three health insurance websites. And then towards the end, we will absolutely have some time for Q&A. Couple of housekeeping items. Yes, this webinar is being recorded and the recording will be made available. The slide deck that we are using would also be made available, as well as the full 50 slide deck report will be made available within the next 24 hours. We'll be posting it on the UXReactor website, and the links will be sent out to everyone that registered. Do type your questions. As you are joining live, you will potentially see a Q&A tab. It's a Zoom tab at the bottom of your screen. Please use that, type your questions. I certainly might not be able to check those questions while I'm speaking, but we'll have some time reserved at the end to go over them. So we have two speakers today. My name is Kuldeep Kelkar, and I am a senior partner experience insights at UXReactor. Jamie, do you want to quickly introduce yourself?
Yeah, thanks, Kuldeep. My name is Jamie. I am a senior experience design strategist, and I've been working very closely with Kuldeep for the last few months to make experience insights a reality.
Cool. Thank you, Jamie. So let's get started. A brief overview of UXReactor. So we are a product insights and product design firm headquartered in the San Francisco Bay Area. Both Jamie and I are from our San Francisco Bay Area studio. We also have studios in Colombia and India. So we do both design and research, the entire end-to-end process for multiple customers. When it comes to services, we offer pretty much all methods and tools that a typical user researcher would need. On the left, you are seeing what we call the rapid agile usability tests. These are faster. These are largely design validation, but that's not it. We also offer competitive benchmarks, surveys. The benchmark that we're going to talk about today is essentially an example of the nature of work that we do. Heuristic evaluations, expert reviews, mixed methods, you name it, pretty much every method that exists, we offer that. And then on the right, we offer what we call the strategic large-scale change management programs. Everything from research operations to how to democratize, if that's your goal within your organization, to impact measurement and management. A lot of user researchers often ask questions on how should they demonstrate impact, and we have what we call the 5V framework and workshops around those. So certainly happy to help anyone that is in the audience and listening to this webinar after the recording is made available. So let's talk about benchmarking, UX competitive benchmarking in specific. So this quote, "You can't manage what you can't measure." This is from Peter Drucker, who's an author and a management guru. But over the last 25 years, I have worked with a lot of executives, uh, executives who make budget decisions, investment decisions. They almost all prescribe to the thesis that, hey, if I don't know what the ROI is, how am I supposed to make that investment decision? And every UX resource, every research resource is at the end of the day, a investment decision for your company. And so UXers often struggle with getting a seat at the table, which is a challenge across the entire industry. I hear this day in, day out. And the way to bridge that gap is largely to be able to articulate user experiences in terms of numbers. Quantifying user experiences seems to be a critical aspect for many of us, and that's largely because The business stakeholders already believe in quantifying and proving ROI and measurement. So how do you measure user experiences? Well, there are several ways. I mean, there is in the last 30 years, there's SAS and SuperQ and a variety of ways of measuring user experiences, and we chose QX score, which is essentially a composite score that combines attitudinal metrics like appearance, ease of use, loyalty, trust. These are what your customers, your patients, your end users say and feel. Combine that with the behavioral metrics of task success, and you get a single score. Why a single score? Because it makes our life easy to communicate the simple answer to a simple question of who won. Anytime you are comparing three options, four options, five options, you want to be able to unequivocally state who the winner was. And that QX score definitely helps with that. But that's not enough. I mean, oftentimes designers, researchers, product managers, engineers need a little bit more than just a score. And so we'll double click on the QX score down to the task, down to the interface issues, and Jamie will walk all of us through some of the high level findings. And then the detailed report will have screen level issues that everyone here should have access to. Okay, so what did we do as part of this competitive UX benchmark? Our focus for this one was health insurance. We combined Blue Cross Blue Shields, Kaiser Permanente, and Cigna, three prominent websites and insurance providers in the state of California. Uh, uh, Health insurance is largely regulated by the states, and so we limited ourselves to users within a particular state and the digital properties websites from these providers that were catering to the patients within a specific state. I'll jump to the headline here. And, this is I'm giving away the story here that across all these three websites and insurance providers, while we have a winner and a loser, the reality is that all of them scored from poor to average. So no one was in the good or best category. They were all in this poor to average category. So why does this matter? Well, I know for sure that health insurance providers are spending billions and billions of dollars. They've been at digital transformation for the last 3 years, 5 years, possibly 10 years. So even after so much investments, it's a little bit disheartening to know that patients are still frustrated with health insurance websites. They're not able to perform the tasks, simple tasks that we gave them, and we'll walk you through the details of the report pretty soon. And so in this report, we have all these actionable insights, not just the scores, but with one limitation, which is this is in general in a competitive UX benchmark, we recommend higher sample size. But for the sake of this engagement, we had a somewhat smaller sample size than compared to a higher sample size that we would want for a competitive UX benchmark. So in this study, we did both moderated and unmoderated. The total sample size was 15, and the participants were from the state of California over the 26 years of age and were the primary decision makers. The three main tasks that we asked these participants to go through is to look for some information, finding a specific doctor that they are interested in based on the criteria that they have, as well as a specialty facility. And Jamie will walk us through the details of what happened, what were the struggles, what were the high marks, and how did each one of the three sites perform. Before we go into the details, here's the thing that I talked about. It makes it really easy to visualize with a single score who won. So in our study, Blue Cross Blue Shields of California was the winner, and Cigna was the third, with Kaiser being in the middle. As you can see, the scores between which are 46 to 65 over a 0 to 100 scale they all were in this poor to average rating. So none of them were in the good or very good part of the scale. So there's plenty of improvement for all three. And again, Jamie will go through the details as we go through the details of the report. If I double click on the QX score, remember, as I said, QX score is a composite score. 50% weightage is given to attitudes and 50% weightage to task success. So let's look at the first one, which is the task success side of the house. These are the three tasks that the participants performed. Task number one, okay, decent success. Between 60 and 80% were successful. Task 2 and Task 3 is where the majority of the issues happen. So for example, Blue Cross Blue Shields, only 20% were successful, and even 40 and 60% are not good numbers. If only 2 out of 10 people are able to successfully perform a task, that's not a good thing. Even with smaller sample sizes, we're fairly certain that that is not a good thing because the issues were obvious. And Cigna was really did not perform that well. When you have 0% task success for the task number three, then that is what impacted their score a lot. And we'll go through specific examples of what the issues were for each of these tasks. When it comes to attitudes, which is the other 50% weightage within QX score, um, I would say by comparison, none of these are high scoring marks, especially around loyalty. When Blue Cross Blue Shields and Kaiser have such low loyalty scores, uh, I understand that within this health insurance domain, patients might not always have that level of brand loyalty with these companies. Having said that, these companies are spending billions of dollars to acquire new patients, to acquire customers, to provide them with a great experience, and yet they are struggling because the loyalty scores are fairly low. So now let's look at the detailed task level insights, high level insights, and I'll hand it over to Jamie. Jamie, do you want to share your screen and I'll
Yeah,
stop
yeah,
sharing?
I can share my screen. Absolutely.
Okay, perfect.
Okie dokie. So, everyone just give me a moment. The usual quirks of sharing a screen. Let's see. And we'll move a few things around here. Okay, perfect. So in the interest of time, I just want to say before we begin that we will only be going over insights that span across all providers. The more detailed insights, as Kuldeep mentioned, they will be sent out in the full report after this webinar. So let's just dive straight in with the first insight here then. We found that all three of the sites followed the same pretty intuitive navigation, which made searching for options for plans and doctors pretty easy on each site. So we actually did notice a lot of consistency in the way the primary navigation was designed. And it seemed to align with the mental models of the journey that users would be going through as they interact with these insurance sites. For example, we see in Blue Shield of California, we see in Kaiser Permanente, and we see in Cigna. All three of these sites start with shop plans, and you can see further down the navigation, they have find a doctor or some variation of that. And each participant really gravitated instantly to these entry points or to these words for the first two tasks, which was to find information about plans and to find a primary care physician. So that just goes to show that this actually is a very effective design pattern to follow. And I do think it's worth mentioning as well that in this study, we presented participants with sites that they've never used before. So those who tested the Cigna site had never used Cigna. Those who used the Kaiser site had never used Kaiser. And some of them even mentioned that because the navigation was so similar to the ones that they've seen before, it made it easier for them to know what steps to take and how to perform this task. I'm just going to go straight into the second insight, which was that sites that offered a single search flow performed better than those that offered variations of search flows. So what do I mean by this? Okay, well, let's focus specifically then on the task of finding a PCP. This is, when we move past that first entry point in the navigation, the participants would then move into the search experience. And what we found was that some sites had multiple possible workflows for how search can be done. So for example, if you look at Blue Shield, they start the users with either a keyword search or a category search. And I'm not really sure why this is, but my assumption would be that it's to help accommodate maybe different use cases or mental models. But this actually ended up being really confusing to participants because it made them feel less confident that they were going down the right path when they had too many options. You can see on the Kaiser Permanente site that they actually merged the two options that Blue Shield had, where you can select either doctor or location here, and whatever keywords you input will be reflected in the next page. However, the thing that got confusing here was that there was another option to click on Go to My Doctor online. This was super confusing and it was very frustrating for participants because it would send them to an entirely different search experience. And they did notice that the search results were also different. So they would spend a lot of time going back and forth just to compare the results. And if I was to just refresh your memory on the chart that Kuldeep had shared before, even though the task completion score for Kaiser was pretty high, Kaiser was actually rated lowest for usability, and this is one of the reasons why. While on the other hand, if we look at Cigna, this was rated highest for usability. Their search was considered to be the most simple because there was just one single flow, and any configurations that were made on this page would be reflected in the search results. So as a result, participants had much higher confidence as they went through this task. And I think at this point, Kuldeep, I just want to get some of your perspective on this, seeing that you've been in the industry for a long time. I know that search experience is a huge experience that spans across almost all industries. And so in your experience, have you seen something similar where, while the intentions are good, having multiple options would actually do more harm than good?
Yeah, I mean, thank you for those detailed insights. And search is there's a design pattern that works for search engines, and that design pattern has been established over the last 20 years at least, right? And every one of the user that is searching on Cigna or Kaiser or other places is absolutely searching on Google or search engines. And so their mental model of how search works is established by the Googles of the world, the Amazons of the world, the other large sites. And so this complicated searching and filtering, narrowing and filtering, the consumers in this day and age pretty much expect a simple text box. They expect the search engine to find all the things that they want. Is there a place for advanced search? Probably, but very few people actually go and use the advanced searcher filtering and so on and so forth. So I would say even Cigna, while it scored higher, has a lot of room to improve for improvement in its search. So yeah, I mean the patterns are established by and the mental models are established by other websites, not necessarily sites within the health insurance category.
Yeah, so it sounds, at least what I'm hearing, is that we need to take into consideration the baseline outside of our own industry to understand what the expectations of users are going to be.
Absolutely.
Mhm. Well, that's a really good point. And you actually do mention that some users or a lot of users don't like to use advanced search filters, which is a really good segue into our next insight here, which is actually that keyword-based searches were preferred over advanced filters. So each of these sites do offer keyword search from the get-go. And that's really good because, all the participants did want to start with a keyword search, and that was what they gravitated towards. But the downside is that the keywords were not always reflected in the search results. And this is specific to task 2, where participants had to find a primary care provider, and task 3, where they had to find specifically a sleep facility. So, for example, if we look at oh, sorry. I don't actually have a screenshot of this, but I can tell you that, for example, on the Kaiser site, when participants specifically typed in primary care provider, they were still getting results for cardiologists or other specialists, or when they would type in sleep as a keyword, nothing in the search results actually reflected back that they had put in the word sleep. So in some cases, participants were forced to refine their search results using the filters. But overall, what we found was that less than half of the participants actually opted to use the filters. And those who did, the general consensus is that it was overwhelming and super cumbersome, as you can see. Um, excuse me. And they really just wanted to be able to use their keywords to get a reliable list of results. And I actually have a really good highlight reel here that we've prepared that kind of encapsulates that experience.
Department. Here we go. I think this is what I want to do. Sleep, sleep, sleep is not listed here. Maybe it's a service. No. But how do we find the sleep? Oh, here we go. Maybe it's under facility type. I am not having any luck here. So why don't we do this and then see if we can type in a keyword? No, why is the keyword field gone? Wouldn't that be super helpful to also have a ability to, now that I've narrowed it down, type in a keyword? Can I do that here maybe? No, the keyword field is gone. Okay, don't like this at all.
All right. So yes, some very good commentary on that experience. So what we're finding is that a lot of times these filters were so detailed and nuanced and required on seeing more. And so more often than not, it actually didn't provide a lot of value to users. And, just as my own commentary, I think this is something that we do see a lot where, there's a lot of complexity in the back end of running a business ecosystem. And a lot of times that complexity surfaces to the consumer experience. But on the consumer side, what they're really looking for is just something simple and reliable, like a keyword search. And so I think a really good takeaway that we're going to be seeing a lot is simpler is better. Um, and I do think also, we're seeing this trend, Kuldeep, and we've been talking at length about this in the office as well, with the rise of generative AI and just the way Google search has been working for ages, that just that simplicity of a natural language search is what consumers really want. Did you want to share any thoughts on that?
Yeah, I mean, just looking at these screens with the number of radio button options, and again, there are design patterns that have been established by not just Google but also e-commerce, travel industry. Book a flight, and you'll have a lot of filters options available. They are hidden. I mean, they are not available at the first glance, but if you would want, then they do are available. And many of these industries have optimized these experiences for a couple of decades now. And so following those patterns is probably going to be the best for most other industries. Not every single industry has to innovate on how things work from a search standpoint or filtering standpoint. There are established patterns and design patterns which form the mental models for consumers. And so, yeah, absolutely. Lots of interesting things to learn from other industries that can be applied here.
Yes, absolutely. Thanks, Kuldeep. I'm going to move on to our next insight. Just taking a look at the time. So the next thing that we found, and this is specific for task 2, is that participants wanted more comprehensive and personal insights on the doctor to aid in their decision making. So just for specifics, we actually asked them to find a doctor that met their specific criteria. So we had them speak out loud to tell us what type of doctor they would want to choose, and then we had them go find that doctor. And what we found is that this was much more of an emotional task than we thought it would be. So, this is going to be someone that they entrust their health and well-being to for 10, 15, maybe for the rest of their life. So they really want to get to know these providers as much as possible before making a selection. And when I say get to know, I don't mean just what's on paper, but I also mean like who they are as people as well. So with that being said, anytime any information was missing, like you see here on the Blue Shield site, that was a deal breaker for them. Cigna, they did a pretty good job of providing comprehensive information, and that was appreciated. But again, it was very transactional, and participants didn't feel like they were really getting to know the doctor well enough. And plus, the photo is missing on this specific example, and that didn't really help the cause either. But when we take a look at the Kaiser page, I would say this was probably most aligned with what they were looking for. And I do think that there's a very small but effective detail that kind of made a difference here, which is that they wrote the page in first person. So you can see they say about me, resources for my patients, my gender. So it really seems like they're hearing the voice of the doctor. And they do feel that it made the page feel a lot more personal and made participants feel like they could get a better sense of who this doctor was besides their credentials. So that was a very interesting finding for us. Okay, just moving on to the last one here, which is that repeated steps were highly noticeable and negatively impacted the user experience. So this insight actually backtracks us to the first task where participants had to find an insurance plan for themselves. And I think a good summary of this takeaway is that users are just very aware of the effort required to do anything on a website. I know I am when I'm on any type of product as well. And it just goes without saying, we've been saying this, this entire session, that just fewer steps, simpler experiences, shorter flows are just very highly desired. And there are two sites where participants were required to take the same step twice, and they really, really noticed it and they would call it out. For example, Blue Shield, in the step where they have to find a plan, the first step is to enter a zip code. So once they do that and they go next, again, they're asked to enter their zip code. So there was a lot of protests to this, asking, why do I have to do this twice? When I just did this, it seems weird that I have to do this. So again, very vocal dissatisfaction with this type of experience. With Cigna as well, you enter a zip code here. And then the next page you see, whoop, is again to enter the location that you live in. So participants are very aware when they've done something twice. They're very aware of the amount of effort that they put into completing a task. And I think the question that arose here, which Kuldeep, maybe you can share some insight on, is why would businesses or why would sites do this when clearly they have the information already? Why would they ask for it twice?
Yeah, I mean, I certainly don't know the specific details of why would Cigna do this or Kaiser do something specific, but I can speculate because this is likely some sort of a technology constraint that either the product teams or the design teams had. But at the end of the day, this resulted in a really poor experience for the participant. And so outside in point of view is really what should drive the entire organization. Maybe there are some complex use cases, maybe authenticated users have a different flow, maybe unauthenticated users have a different flow, but this is all part of defining each persona, their customer journey, and optimizing every aspect of that journey so that you don't end up with these types of situations where you have the same question being asked twice, enter zip code once, then enter zip code twice. I mean, that clearly I would call it a bug. So while I don't know the exact details of why this happens on this website, it feels a little bit like a technology issue or a bug or some sort of a constraint, and not a design decision. I can't think that this would be a design decision on their part.
Right. So, I mean, it goes without saying that the technology should also be in favor of a positive user experience.
Exactly. Yeah.
Okay. Well, again, just looking at the time, I think we have just about a minute left. This was just a taste of what the report contains. As we mentioned before, we only had time to talk about the insights that span across all of the websites, but we will be sending this full report to everyone who attended here, and it will be available on our site as well. And this is going to include details per site, per task, as well as links to the corresponding highlight reels. It's a lot of really good stuff. And on our site, you can access that through going to Perspective and in all topics or UX research. I don't know if I'll have time for Q&A, but before we move on, Kuldeep, could you take a moment to maybe talk about our next upcoming webinar? Because I think this is going to be one that excites a lot of people.
Absolutely. I mean, thank you for everyone that attended today's session. Next Thursday, February 15th, we have at 11 a.m. Pacific to Eastern, AI for UX. Of course, this is a big topic, and everyone that is attending this session probably recognizes Jacob Nielsen and Kate Moran. So Jacob Nielsen has been talking a lot about AI in UX or AI for UX, and they have between Jacob and Kate, they have a lot of published articles. And so next Thursday, uh, I'll be speaking at length, insightful conversation with Jacob. I don't, hopefully nobody misses it. Uh, we have limited seats, so do register for it, and looking forward to seeing everyone next Thursday.
Awesome. Thanks, Kuldeep. I mean, with that being said, I do think we're just a little over time right now. We did get a few questions, which we will collate and we will respond to in the article as well as in the follow-up email that we have. So apologies for not having enough time for Q&A, but thank you so much for attending. And Kuldeep, any final words you'd like to say?
I mean, so I assume people will be anyone that can stick around would potentially stick around. But thank you for all those that attended. Jamie, I suggest we just go through a couple of questions,
Okay.
and then attendees, if you can keep typing your questions, you can see a few questions have come in. So certainly we will spend no more than 5 minutes, and then
Sure.
wrap up with answers as a follow on. So here's the first question that came in. Jamie, maybe you can answer this. How long does it take for these types of UX benchmarking studies?
How long does it take? So this is an answer that everyone hates to hear, which is it depends. But with user research, I think a lot of it does depend on a lot of variables. Obviously, like methods are one thing, but in this case, it's the sample size that's really going to determine the length of the study. So for this particular study, where we did a round of unmoderated and a round of moderated with total 15 participants, that took us about 5 weeks to complete end to end. But as we mentioned before, we do recommend using a higher sample size just to get a little bit more of a confidence level with the results. And that then would increase the length of the study.
Got it. And then there is a related question. What sample size do you recommend for competitive benchmarking? I'll address part of it, and then certainly, Jamie, your take, right? So as I said, the higher the better. For this type of research, when you want to show who the winners are, what the scores are, you are going to get the sample size question from your executives. And most business stakeholders understand the concept of confidence interval or statistical significance. Even if they don't fully understand it, they have heard it enough times, and they deal with the world of analytics where there are conversion rates and hundreds of thousands of sample sizes. So these sample sizes of 5 to 15 are probably not enough for competitive benchmark. Technically, if you want to compare a few options and you want it to be within 10% confidence interval comparisons across age, you need somewhere in the 50 to 200 at least. Now, if you can afford to go higher, do go higher, but there is a diminishing marginal utility that kicks in where the added value is lower and lower. So for this type of study, I would have recommended somewhere between 50 to 100 at least. Jamie?
Yeah, I agree. Like, I think higher is always better. It's hard to always justify the higher number, but I think it really depends on what's at stake. So if there's a lot at stake here, you really want to advocate for that higher sample size so that even the business leaders can make confident decisions with the business strategy.
And then a one quick short one before we wrap up. This is a third question that came in. Do you recommend moderated? or unmoderated or both for this type of competitive benchmarks?
So we chose to go with unmoderated and moderated. And the reason why we did this was we wanted to see where a lot of the clusters of problems were, and then use the moderated as an opportunity to dig into those problems. And I think this kind of combination is really good in that you can first see where you can see where you need to focus before you dive deep. Whereas if we were doing all moderated, I think sometimes going in depth so quickly, with so many participants, it might be hard to see those clusters. Whereas unmoderated, it was very easy because they're very fast studies. You see very quantitatively where those issues are. So I would recommend using a combination just to speed things up a little bit. But if you want a lot more depth, I think moderated is a good choice. However, if you feel that you kind of have a good grasp of the insights and you just want to see more so where those clusters are, then unmoderated is a very fast option that can get you those answers. Any thoughts on that, Kuldeep?
No, I think I agree. And there is one more comment slash question about the zip code duplication. So for the attendee that had that question, feel free to ping us offline. You can send a note to hello@uxreactor.com. And certainly we can, I mean, if you are from the domain, if you work for one of these companies, you probably know more than we do. And certainly the entire report will be of interest to you. So do reach out to us offline, and we're happy to deep dive a little bit. So thank you again. Thank you for everyone that attended. Hopefully, we'll see you again next Thursday for the lively conversation with Jacob Nielsen and Kate Moran. Wonderful job, Jamie. This is a fantastic report, in-depth, 50 slides. Thank you to the entire UXReactor team that spent 5 weeks working on this. So great work, Jamie and team. Fabulous work.
So much thanks to the team. They did an awesome job.
Okay. Thank you, everyone.
All right. Thank you,
Bye-bye.
everyone. Take care.